Hello everyone, my name is Aarti and you're watching HW News. Around October last year, a government-appointed expert committee said that the number of active symptomatic COVID-19 cases in India had already peaked at around 10 lakhs on September 17th. Post the peak, COVID-19 cases were declining in the country. It also predicted that the trajectory may lead to a cumulative figure of 1.06 crore with negligible growth by the end of February next year, that is February 2021. If you remember, in January this year, Prime Minister Narendra Modi had claimed early victory over the coronavirus and said, and I quote, India not only managed to beat the COVID-19 crisis, it has also helped over 150 countries in the process despite predictions for the worst. At World Economic Forum's Davos dialogue, PM Modi said that at the beginning of the pandemic, global experts had predicted that India will face a tsunami of COVID-19 cases. While some experts said that 7 to 8 million COVID cases, others said more, but with the use of public participation and technology for testing and tracking, India was able to turn the fight against COVID-19 into a mass movement. Today, COVID cases are declining rapidly in India, and this is what Prime Minister Modi had said at the global platform in the month of February. Let us have a look at what he said.
कई नामी एक्सपर्ट्स और बड़ी-बड़ी संस्थाओं ने क्या-क्या कहा था। भविष्यवाणी की गई थी कि पूरी दुनिया में कोरोना से सबसे प्रभावित देश भारत होगा। कहा गया कि भारत में कोरोना संक्रमण की सुनामी आएगी। किसी ने 700-800 मिलियन भारतीयों को कोरोना होने की बात कही तो किसी ने 2 मिलियन से ज्यादा लोगों की मृत्यु का अंदेशा जताया था। दुनिया के बड़े बड़े और आधुनिक हेल्थ इंफ्रास्ट्रक्चर वाले देशों का उस समय जो हाल था वो देखकर भारत जैसे विकासशील देश के लिए दुनिया की चिंता भी स्वाभाविक थी। आप अंदाजा लगा सकते हैं कि तब हमारी क्या मनोदशा रही होगी। लेकिन भारत ने खुद पर निराशा को हावी नहीं होने दिया। भारत प्रोएक्टिव पब्लिक पार्टिसिपेशन के अप्रोच के साथ आगे बढ़ता रहा। हमने कोविड स्पेसिफिक हेल्थ इंफ्रास्ट्रक्चर डेवलप करने पर जोर लगाया। हमने अपने ह्यूमन रिसोर्सेज को कोरोना से लड़ने के लिए ट्रेन किया। टेस्टिंग और ट्रैकिंग इसके लिए टेक्नोलॉजी का भरपूर इस्तेमाल किया। इस लड़ाई में भारत के प्रत्येक व्यक्ति ने धैर्य के साथ अपने कर्तव्यों का पालन किया। कोरोना के खिलाफ लड़ाई को एक जन आंदोलन में बदल दिया।
In less than 2 months after this statement, the second wave of the pandemic hit India, and we all pretty much have witnessed the havoc it wreaked and the scale of it. While the government was criticized for the mishandling of the COVID-19 pandemic and the second wave for claiming early victory over the virus than paying attention to the rising cases, the expert committee also was criticized for the prediction that went wrong. Now, according to an NYT report, the Indian Council of Medical Research's top leadership tailored the agency's findings on the spread of COVID-19 and its possible trajectory to suit Prime Minister Narendra Modi's agenda. Not only that, it also pressured scientists to downplay the threat posed by the pandemic. The report throws light on how the top medical body in India, which was supposed to show us the right direction, prioritized the Prime Minister's ambitions of opening up the economy over the warning by scientists. Those who questioned it were either asked to mind their own business or told to keep quiet. Today in this video, we will talk about this story in detail. But before that, if you are watching this video on YouTube, please do subscribe to our channel. Like this video, give us a super thanks if you like this video and comment below the video. And if you are watching this video on Facebook, please do like our page and share this video to as many people as possible. Now, as I said at the beginning of the video, in September 2020, a mathematical supermodel on COVID-19 spread in India presented by an expert committee had said that the pandemic can be controlled by early 2021 with minimal active symptomatic infections. The committee comprised scientists from IITs, IISc Bangalore, ISI Kolkata, and CMC Vellore. If you go through the Health Ministry briefings around October last year, you will find the bureaucrats referring to the findings of this committee. But was this just an idealistic prediction? Many scientists thought so, and even the Lancet slammed ICMR for straying from scientific evidence to present a more optimistic assessment at that point of time. The attitude that coronavirus has almost ended seeped in the masses after this. And add to it the mass rallies organized for elections in Bihar. The report states that the ICMR's working were beginning to be influenced by politics early last year, the time when the government started singling out the Tablighi Jamaat congregation for the spread of novel coronavirus through India. According to the report, ICMR also contributed to this narrative. A source in the agency reportedly said that the gathering had undone the benefits of the nationwide lockdown. Now, the report also quotes Raman Gangakedekar, who was then ICMR's chief scientist, saying that he expressed anguish over the government's statement targeting Muslims. But ICMR DG Balram Bhargava reportedly told him that the matter should not concern him. Another person, Anup Agrawal, who worked as a scientist with ICMR, was quoted as saying that when he raised concerns about the supermodel to ICMR Director General Balram Bhargava, he was reportedly told it was none of his concern. He resigned in the month of October 2020. Now, the report also talks about instances when ICMR leadership shot down predictions which were contrary to the government's optimism. First instance, the report cites the example of a June 2020 study which was funded by the ICMR. The study had concluded that the lockdown had only delayed the peak and not helped avoid it. Its authors withdrew the study within days of it being uploaded online. In a tweet, ICMR also said that the study was not peer-reviewed and that it does not reflect the official position of ICMR. According to New York Times, one of the study's authors said they had withdrawn the paper amid pressure from the agency's leaders who questioned its finding and complained that it had been published before they had reviewed it. Example number 2. The report claims in July 2020, Bhargava also directed scientists to withhold data from the country's first seroprevalence survey. The survey apparently showed that infection rates were high in many cities. In a July 25 email that the New York Times said it had reviewed, Bhargava said, and I quote, "I have not got approval to publish the data. You are sitting in an ivory tower and not understanding the sensitivity. I am sincerely disappointed." The health ministry officials then were telling the nation how India was better in terms of COVID-19 management than other nations, how the COVID cases per million population were lesser than the world average, and that the COVID-19 numbers should not be looked at in absolute numbers. Third instance, in January 2021, when the study published in the journal Nature predicted a second wave, ICMR's leadership pressured one of its authors who also worked for the agency to remove his affiliation from the paper. The report quotes several current and former ICMR scientists saying that they did not speak up against ICMR's recommendation of ineffective COVID-19 treatments like plasma therapy and using hydroxychloroquine because they considered these avenues to be politically protected. Agrawal also pointed to a culture of silence in the top medical body and how the mid-level scientists kept quiet and did not question the top leadership fearing backlash in their jobs. The report is nothing but a damning indictment on India's top medical body. The basic principle of science is to question, experiment, analyze, and then come to a conclusion. The top medical body generally is a guiding light that is supposed to show the right direction to the government in times like pandemics. Its job is not to toe the line drawn by the government, nor get influenced by the government's goals, but it is to believe scientific evidence, even if it means contradicting the government predictions. After the revelations in the report, the ICMR now has much explaining to do. Do let us know what you think about this in the comment box below. For more news and updates, you can log on to www.hwnews.in. Also, before I end this video, if you want us to continue reporting on such stories, if you want us to speak truth to power, please do support us. Earlier, we also had YouTube membership. We still have YouTube membership option, but now we also have an option through which you can support us, and that option is available on our website. So please Go to our website, click on the support on the topmost toolbar, and you can select which way you want to support us, if you want to support us through monthly one-time payment or yearly one-time payment. Please do support us because your support matters the most to us. Thank you so much for listening to us. Thank you so much for watching HW News.